Yay!
Hello.
Touchdown. Technology
Hello,
works.
everybody. I'm Kalana Barfield Brown, and I'm taking over Julia's Instagram page today. I've been posting from her page all day today for Share the Mic Now campaign, and this campaign is all about amplifying the voices of Black women, our issues, our concerns. And Julia was so gracious to give her page to me today. I'm actually pregnant right now with my second baby. And a big issue that I have is reproductive justice. I just did a post on Julia's page about it, and I wanted to dial in one of my best friends, Dr. Alisha Liggett. She and I grew up together in Seattle, Washington. We've been friends since middle school. She studied at Columbia and University of Maryland, and she is a family practice doctor. And a lot of her work is specifically geared toward Black women in her practice. And I wanted to jump on with her to just enlighten Julia's community about what reproductive justice is, and what steps we can be taking to fight against it. So, Alisha, I'll let you introduce yourself, and then we can get
Yes.
into it.
Thank you so much for inviting me on, and thank you so much, Julia, for giving us this amazing platform to speak to your followers on Instagram about the amazing work that's being done in the reproductive justice field, and just really what reproductive justice is, because it's a relatively new term. I would say maybe the last 20 or 30 years, but it was a term that was coined by Black women who recognized that within the larger feminist movement that was happening in the United States at that time, which was in the 70s, that really the voices of Black women really needed to be more amplified, because there were specific issues that were our community was being faced with that weren't really kind of being addressed by the mainstream feminist movement. So it was an opportunity to kind of really speak to that, and for Black women ourselves to kind of really come to the forefront and amplify our voices around those particular issues. So
Yeah. So I'm pregnant, and I can't help but to be nervous about maternal mortality.
yes.
We've talked about this, and
Yes, we
the
have.
death rates, and and how scary it is for a Black woman. So can you kind of talk about that and talk about those stats?
Yeah, absolutely. I mean, it's absolutely horrifying that the rates of Black maternal mortality related to pregnancy and childbirth are around 3 to 4 times that compared to white women. And when you think about what that means, that really means that the United States is the worst and most dangerous place to deliver your child as a Black woman among all developed nations in the world. So that's really
Mm,
saying a lot. And we're the only developed nation where our infant mortality and pregnancy related deaths are actually going up. Right.
yeah.
So, that really does say a lot about, the state of our healthcare system, which, the COVID epidemic has really amplified these rifts and disparities within healthcare.
Mm,
So it's a super important issue. Women should really have the right to have their children in a place, in a manner that's safe, that's free of discrimination and bias.
mhm,
And what a lot of the research is showing is that these death rates are really fueled at the core, at the root. When you basically control for socioeconomic status, you control for educational level, you
mhm.
control for all of these variables that can basically change someone's outcome. You control for access, that these stats still remain true. And really at the root of all this is racism and discrimination and medical bias.
Okay.
So that's really what we're finding.
And can you give some examples of how racism directly impacts reproductive justice or maternal
Yeah, absolutely.
mortality?
So absolutely. So really, it's a three-pronged issue, right? So if you really kind of start from what is racism, racism is basically a power structure, right? A power differential that really lends bias and favors certain races over other races, and really allocates resources to, obviously in the case of the United States, to white people, as opposed to people of color, right? And so what that means in terms of medicine is it means that it's an issue of access in terms of the way that the medical system is set up, is it really is split based on insurance, right? People who have Medicaid or Medicare insurance are often go to different hospitals, different clinics. For people who have commercial insurance, and those things are all kind of split along socioeconomic lines, right? So, you know, people of color are more often likely to end up in public hospital systems that are more underfunded and under-resourced. So, you know, just kind of starting there, you know, that's already kind of a barrier to receiving adequate care and the resources that you need. The second kind of layer to this is really the physician bias. And I think people don't really talk as much about this piece because it really does require doctors to go inward and think about what is it that, you know, what are my preconceived notions that I'm bringing into the clinic visit with my patients. And why this is super important is because medicine is an art just as much as it is a science, right? Like, of course, you know, we have all this medical information and knowledge that we use, but every person is individual, right? So you can't necessarily apply the same information to the same, you know, in the same way for every person. So, you know, a lot of that is very nuanced. A lot of that is based on your experience with specific types of people. Also in your life experience, you bring with that, you bring your perspective into the patient room when you're speaking and you're treating people, right? Because there is a real therapeutic alliance that has to take place where you ally yourself with your patient. And if you can't do that, if these kind of biases already exist, then that is there's a, you know, an issue with really making that connection with people. So that really does, and the research shows that it does affect outcomes, right? And then the third layer is really, you know, Black women ourselves in terms of the medical mistrust that we feel and the lack of connection that we actually feel to the medical institution. And that really is rooted in a very long history of medical mistrust in, you know, within the African American community that really dates back to the time of slavery. A lot of the advancements in obstetrics and gynecology that we see today are really due to the unethical and criminal experimentation on Black slaves. So, you know, that oral history, that oral tradition is still very strong in our community. I think also in terms of Western medicine, it really tends to prioritize our healthcare system as opposed to more holistic health, right? So those are kind of all some reasons that may put barriers in front of women to obtaining and maintaining good care.
Yeah. What actions can mothers take or expecting mothers take to really help advocate for themselves? I know for me, you know, when I gave birth to my daughter, if I didn't have my mom there to even just be able to speak up for me during labor, I don't know what would have happened. And I know you and I have talked about the importance of doulas and just having an ally and having that advocate for you. So can you talk about that, and if there's any if there are any resources that Black women can look into to help with that?
Yeah, absolutely. I mean, I think, you know, pregnancy is such a vulnerable time. It's a happy time. It's an amazing time in a woman's life, but it's also like a very vulnerable time, mostly because she's just experiencing so much change in her body, mind, and spirit. Her family's growing. Her finances are changing. So with all that, it's a
And I
time
also
that,
think too, you know, it's as outspoken as I am, and you know, I sometimes find doctors to be intimidating.
yeah.
And you know, when you are at your doctor's visit, like I find myself like, okay, one more question. Can I ask one more question? Or a lot of times I may, you know, I may avoid asking a question that I wanted to answer just because of intimidation.
Yeah, because you're trying to be respectful of the person's time. They seem rushed. They seem like they have something else to do. But that's really not the way we should be. And I think that's really a systemic issue. It's not necessarily an issue with the doctor. The way that our healthcare system is set up is such that, you know, the appointment times are finite. And, you know, because we work in a fee-for-service system, that means that it's really seeing more patients is incentivized over quality. So in that case, even if someone wants to spend more time with you and speak with you, sometimes it's just very difficult because there's a lot of kind of push and pull within the system that forces them to keep working.
Yeah.
Unfortunately, I think doctors have become, over the last 20 years, very disempowered within healthcare, because we're all like bleeding hearts, which is why we go into medicine. The business of medicine has really been taken over by business people and by lawyers. And because it works in a capitalist model, unfortunately, sometimes our voices are muted in terms of where the focus should be, which should be on people, on human lives, on quality. But that often gets lost in the sauce. So,
Yeah, I can imagine.
yeah.
Are there any organizations or any, resources that people can look into?
Yeah, absolutely. I mean, to go back to your other question,
Yeah.
utilizing a doula, which is super,
Mhm.
super, super important, really for everyone, because as you mentioned, it can be very intimidating for women, but particularly women of color who are, already vulnerable, already disempowered, people who, have many kind of these things stacked against them. It really helps to bring an advocate.
Yeah.
There are doula services that women who are of low income can access so that they can get a doula for free or low cost, because unfortunately doulas are not covered by insurance, even though the medical research does show that they, reduce C-section rates, that they reduce mortality rates having a doula, that they, reduce rates of utilization of Pitocin, which is the labor induction drugs, reduce the rates of even using pain medications. I mean, this is the way that women used to birth, hundreds of years ago, where they'd have a team of women around them to champion them, to massage them, to sing to them, to pray with them, to
So important.
community, yeah, to make them
Yeah.
feel calm. But it's just become so medicalized that women are now very isolated in their journey of birth, and that really does put a lot of added stress, and that can affect the outcomes. So
Right.
definitely having a doula, having an advocate is super important, especially one that's knowledgeable, can ask questions, can speak up for you,
Yeah.
that knows what you want, so that in the event you're just having a contraction and you can't talk, or you don't want to talk because
Right.
you don't want to,
Right.
that somebody can pipe up and speak for you. That's just really important, because otherwise decisions are made for you without your input. Um, and then the other thing is birth options, which are so important. Like, I think, because we're like 80s babies, we were like born in a hospital, and everybody we know is born in a hospital. But we forget that, up until what, the 60s, when, kids were born at home, and they
Yeah.
were born in birthing centers. And, it's really those places for, of course, low risk women, or women who don't have, a high risk of having complications and have healthy pregnancies. That's really an option for them. And I think sometimes we forget that. So of course, like, places like birthing centers or even home births are options for people that they can look into, so that they can really kind of craft the birth experience they want, and also have more control over that experience. In the
Yeah.
hospital, sometimes that autonomy is really taken from you when you're strapped to the bed, and you
Yeah.
can't get
What
up.
about people
And you
who
can't eat.
might, right? What about people who might not be directly affected? I mean, obviously, I'm a, expecting mom, so this is something that I'm super passionate about, and I know so many Black women who are terrified about this. But what
Yeah.
about people who are just concerned and want to help? Are there any actionable items people can take to advocate for support in this issue?
Yeah, absolutely. I mean, first and foremost, we all have to recognize that, the root cause of these disparities and is discrimination and bias.
Hmm.
So, it's important for us as a society to really come to a reckoning with that, and really, um, you know, I think stop trying to suppress the obvious, right? Because
Right.
it's really important for us to try to continue to move forward and evolve, so that we can all, these disparities, these gaps can start to close. So I
Hmm.
think once we kind of understand the problem and we can speak about that and process that, we can then move towards solutions, right?
Totally.
So that's super important. And I think it starts, it really starts in everyone's home and with their families. I think,
Hmm.
we are the strongest influencers over our parents. Like, my parents are
Hmm.
super conservative, and I'm super like, but
Yeah.
despite that, they listen. right? Like you have their ears. So, you know, it's
Mm-hmm.
super important to have conversations with your families and friends and people in your social circles about, you know, racism, about beliefs, about discrimination, bias. Talk to them even about their experiences, what it was
Yeah.
like for them growing up in the 50s and 60s and how they confronted, you know, these issues of discrimination and bias, and just reflective conversations that allow
Yeah.
people that space to start to process and evolve past some of the thinking that they,
I
you
think
know,
so many people, avoid having these conversations, and they're so
yeah,
crucial. When I think about growing up, and
yeah,
you know this because
yeah,
we
in
grew up
Seattle,
together, these were these were things that we talked about around the dinner table with my dad.
yes,
You know that
absolutely. I
we were
mean, you
very
know,
open and we
the
talked
baby.
about it. I know. We talked about it, and so I think parents have to have these conversations early with their kids, and I think that
Yeah,
that's like number one. Like you said,
absolutely.
it starts at home.
Yeah, it starts at home. It starts early, because these kind of biases even start with children on the playground, right? And we know that around the second, third grade age is when these children even start to internalize racism and discrimination and bias that's levied against them by other children.
Hmm.
So definitely, absolutely starts there. And then I would say just being present for what's happening, lending an ear, and being supportive. So that can include, supporting causes that are close to your heart. For example, you're super interested in Black maternal health.
Hmm.
If, and these are stories I feel like that potentially could be shared across like racial lines, right? We're all humans, so we're all experiencing this crazy whirlwind, experience called life. So
Yeah.
there's always, experiences that, are relatable that people can ally themselves to, and causes that are working to try to mitigate those specific issues as well. So finding out what those causes are, listening to what the issues are, supporting through donation,
Hmm.
sharing and posting, things that move you and motivate you on your social media. Um, and also bringing these things into the workplace also. I mean, I think this time has been so amazing in that there's been so much dramatic changes, even in like the corporate space and the
Yeah.
law space and medicine and, and, criminal justice, kind of all these fields and structures that you wouldn't have expected, but it's kind
Yeah.
of opening up.
We're
So,
starting to see progress. We are starting to
yeah,
see progress. And
it's
that makes
because
me
people
so
are
happy.
listening. Yeah,
Yeah,
because
people are
people are
listening.
listening. Yeah.
Yeah.
So that part is just awesome.
Yeah.
And
Well, thank
yeah,
you so much, Dr. Alisha.
you're
Um,
welcome,
you
Booski.
are so brilliant. And I always, it's so nice to have such a brilliant doctor on call during all times. Thank you for shedding light on this topic. Thank you, Julia, for
Yes,
giving
Miss
us your
Julia.
platform. We love you so
Thank you
much.
so much. Been a
And
fan
thank
since I
you
was like
to
3.
Yes. And thank you to share the mic now, just for
Yes.
starting this campaign, having these conversations all day, watching some of my friends take over accounts of, super influential people and talking
Hmm.
about issues that concern our community. It's been beautiful to watch. And I hope that we're able to enlighten and bring awareness
Hmm.
more globally to our issues. So thank you so much.
Yeah.
And have a good night.
Bye, everyone. Nighty night.
Bye.